Can you hear us, Valerie? You're on mute.
Okay.
Okay.
Hi, guys. My apologies. Okay. I'm supposed to be extremely quick, so I'm going to run. What I'm going to try and do in this talk today is convince you that social resilience is relevant as to understanding immigrant integration, especially during a pandemic, that the institutions have mitigated the unequal impacts of COVID-19 through a variety of strategies. I'm going to concentrate on 4 changes in service provision, ways of exchanging information, heightened and new forms of collaboration, and some interesting efforts at advocacy. And I'm going to try and convince you that a social resilience approach has the advantages of being relational, dynamic, takes account of those social and geographical differences that Marcia was talking about, and it allows for the possibility of real social transformation. So 10 minutes apparently. So let me get moving here. I'm going to do this in 4 parts. I'm going to talk very briefly about what I mean by a social resilience approach. I'm going to talk a little bit about the impacts of COVID-19 on migrants. I'm going to talk about those institutional responses and a little bit concluding with what are some of the merits. I'm not interested in this view of resilience. There is an excessive amount of discussion of resilience. Most of it talks about resilience as an individual attribute. If anyone can tell me the city where these 2 young adults are sitting, please let me know in the chat. I've been pondering that for several days. But I want to argue that this individual view of resilience is simply an attempt to force each of us to be responsible for the challenges we encounter during our lifetimes and does not take account of social inequalities and social equities. In contrast, a social resilience approach is really describing the capacity of migrants to navigate resources and the institutional supports that they need to overcome settlement challenges. And first and foremost, it emphasizes relations. Migration studies are full of information about the relations that help and hinder migrants. And they begin with the relations between migrants and other individuals. Those relations with other people can be sources of valuable information. They can provide key resources, and they can also be sources of misinformation. And we sometimes divide them up between bridging and bonding resources, bonding being among migrants relating with other migrants or other people with whom they share some social characteristic, and bridging being the resources, being the social ties that we think give migrants access to a wider range of resources. There's a third kind of capital, though, that's also important that the social resilience approach really emphasizes. And those are relationships of individuals to institutions, sometimes called linking capital, and the relationships between institutions. Because in order for individuals to be resilient, to figure out how to overcome challenges, the institutions that serve them have to also be resilient. The second aspect of social resilience is that it emphasizes that resilience is learned and dynamic. We aren't born with, and we don't have a stock of resilience that we use up. Or instead, one learns to have this capacity to navigate resources and institutional supports to overcome challenges by overcoming challenges or even by failing to overcome them. And I particularly like the emphasis on learning for 2 reasons. Again, it counters that idea, the very neoliberal idea that John talked about, that individuals are responsible for their own fate, as if we all began life with a completely even playing field. And secondly, it focuses on dynamics. It says that integration is a process, and we need to pay attention to that process because you learn as you overcome or even fail to overcome challenges. Third thing about social resilience, and this is what Hall and Lamont really contributed, is that it is shaped by institutional context. People's capacity to navigate resources really depends upon the full range of institutions with which they have contact. And that is particularly true for migrants. And we know this from studies comparing migrants who have found their way to the immigrant serving agencies that John mentioned and those who have not. And finally, the most interesting part of social resilience and the part that appeals to me the most is that it is potentially transformative, because social resilience is about acknowledging that there are social inequalities, and there exists a set of institutions committed to helping individuals overcome those social inequalities. Part of the role of those institutions and of migrants themselves is to transform that institutional landscape and hopefully ultimately lead to a reduction in social inequality. Now, this is all terribly idealistic and I love it. I never thought I was an idealist, but I am at heart. And as I get older, I become more idealistic. But I think we've actually seen it in operation during the pandemic, particularly for migrants. The impact of COVID-19, as Marcia mentioned, has been very unequal for migrants. The map that I'm showing you is a map of Toronto, but it could be any large city in Canada. The darker areas are the areas with the highest COVID-19 rates. This is up to February 18th, 2022. And if you are at all familiar with Toronto, you will know that COVID-19 rates are higher in areas with a high proportion of immigrants, areas with low incomes, and areas with minority populations. And these are overlapping groups, and they are concentrated in Toronto in the Northwest and in a wider band to the Northeast. In addition to being more likely to catch COVID-19, immigrants were also more likely to die from COVID-19. This is a recent report, or not a recent report. This is a report that came out in June 2021, pointing out that in the first two waves of the pandemic, COVID-19 deaths were about twice as high for immigrants as for the Canadian-born population. And finally, vaccine uptake has been particularly challenging in neighborhoods dominated by migrants, particularly recent migrants, and it has taken a full press campaign for public health units to adopt an equity lens so that they concentrated their vaccination efforts in the neighborhoods and among the populations with both the highest rates of COVID and the highest rates of death from COVID. The delays in implementing equitable vaccination strategies are evident in the disproportionate share of COVID-19 cases among visible minorities. This is just in Toronto. Wherever the black bar is higher than that mustardy colored bar, the share of COVID cases is higher than the group's share of Toronto population. I want to draw your attention to blacks, and on the other hand, to whites. Blacks are 9% of the Toronto metropolitan population and 21% of COVID cases by July 16th, 2020, and the relationship is reversed for whites. And it is also clear that we needed that equity lens because of the disproportionate numbers of people in low-income households who have also experienced COVID, compared with the very low share of COVID cases from households which are affluent. How did institutions respond? I'm going to concentrate on the immigrant serving agencies because they are the institutions that many migrants interact with, not all, of course, but they also provide an avenue into understanding how other institutions were responding to COVID-19. And there are 4 changes that happened. There were changes in service provision, changes in the exchange of information, changes in collaboration, and finally, changes in advocacy. So in terms of service provision, 100% of immigrant serving agencies in Ontario put some services online within 3 months of the pandemic being declared. Now, this is an extraordinary achievement. This is a sector that is underfunded, never has enough money for technology, has many staff members who are not really comfortable with technology, and where change usually occurs fairly slowly. It's been very interesting to see what's happened. In interviews that John and I have been conducting, we've learned that this process of putting services online, which was a Herculean effort, has accelerated technological change across the board in these agencies. So not just their client services, but their accounting, the way they communicate with their workforce, et cetera, has also been changed profoundly. It has expanded eligibility for services. As the executive director of one immigrant serving agency said to us, well, you know, we put all our childcare materials on the web. Anybody can have a look at them. Anybody can look at and join our language classes. So the constant omission of migrants with temporary visas or migrants with precarious status has been overcome by putting services online. Not completely and not enough, but it shows how it could happen. It raises really interesting possibilities. The other thing that the immigrant service agencies did was they realized very quickly that there were certain migrants who needed in-person services. Recent government-assisted refugees were one. And they managed to restart in-person services. Now, my university didn't manage to reopen until September of 2021. It is much better resourced than any of these immigrant service agencies. So again, 2 things made this possible. Herculean work, developing the protocols and figuring out how to do it safely at a time when we thought you could get COVID by touching a surface, and we were all washing our hands so much that our skin was peeling off. And secondly, the commitment of staff to their clients. The staff of many of the immigrant service agencies are migrants themselves, and they all went back to work in the workplace, volunteered to do this. They thought it was so important. And finally, the immigrant service agencies have been assisting with volunteer efforts. It is many of the immigrant service agencies that are the source of volunteers for the vaccination effort, volunteers who have gone out and translated materials, put information on social media. But they are also the places where public health units have gone to recruit community ambassadors to try and improve vaccination uptake. In terms of information exchange, what we have heard from the immigrant service agencies is that they realized very quickly that there was a need for information about how COVID was affecting migrants, the differential effects. They knew right away that COVID would mean different things for different migrants. So, and here in Ontario, what proved particularly helpful was the local immigration partnerships. These are consultation tables established with funding from the federal government that bring together public and private groups and institutions to discuss immigration issues. We heard about, for example, in Ontario, and those of you who were here for the first webinar will know about it, that the Ontario LIP immediately established a consultation table, regularly having 40 to 50 participants to discuss COVID on a regular basis. From this consultation table, they were able to identify issues that needed to be resolved, information that they needed, and find sources of information. The consultation tables, as we'll see, also helped strengthen relationships among actors in the sector. There was a tremendous need for information. And I want to talk about two ways it was resolved. This graph that is here comes from COSTI. COSTI has a service called International Student Connect that is funded by the provincial government for international students. And they ask the participants in that service, who are mainly university directors of international student services, to report on the factors affecting international students' mental health. And they got tremendous responses and were able to establish that for international students, they were mostly concerned about lack of employment. They were very worried about family back home. Most of them could not travel back home. Without a job, without the prospect of a job, most of them had been laid off or their visas were running out. They were also tremendously concerned about financial issues. And in the last webinar, these are exactly the types of issues that Shutama found students in Sudbury were concerned about. The second example that I want to give is that OCASI, John has already mentioned it, the umbrella organization in Ontario, did a survey of all its member agencies, both of workers and of management, in September 2020 after the first wave. And they were able to learn how the pandemic was affecting agency operations and share that experience so that managers and workers could begin to adjust both what they were doing, learn from each other, but also realize that there was a shared set of issues that would require a collective response. Everyone has told us increased collaboration. Existing relationships deepened. One of the reasons why immigrant settlement agencies, immigrant serving agencies were able to make that online transformation of services was because the schools were handing tablets out to every child. They were also ensuring that every child could be hooked up. Now, this took some months. The relationships among immigrant service agencies and the other institutions that they already were connected with deepened. They also talk about new partners. Several of the LIPs for the first time found themselves working closely, not just with the large established food banks, but with new emerging food banks serving very local populations. In some cases, a high rise, in other cases, people with particular addictions living in a particular community. There was an attempt to extend collaboration to include a diverse set of actors. So in addition to other nonprofits, the immigrant settlement agencies tried to strengthen and expand their relationships with municipal, provincial, and federal governments. And every one of the immigrant service agencies that we've talked to has talked about extending their relationships and creating new relationships with groups that are not formally part of the sector. Ethnocultural groups, faith organizations, these grassroots food bank organizations. There has been a real effort and interest in sort of expanding that web of relationships. A lot of what has happened in terms of collaboration reflects past experience. Without exception, we have heard that people learned from the Syrian Refugee Initiative when the pandemic started. They took what they had done in the Syrian Refugee Initiative, which required tremendous collaboration, and tried to modify those activities. Finally, there has been an expansion of advocacy. Now, advocacy is complicated for the immigrant serving agencies. There are strict limits on their ability to advocate. This is a picture from No One Is Illegal. No One Is Illegal is one of those grassroots organizations, and it has no limits on its advocacy. So the immigrant serving agencies have got around the limits on advocacy imposed by their funding and by legislation in two ways. In some cases, they have simply challenged them and said, we are going to advocate, we must advocate because COVID-19 is affecting our communities, our clients so severely. In other cases, they have relied on others to advocate for them. Sometimes it has been municipal government officials who have been able to go and advocate, often taking concerns they hear at these consultation tables built on the lips. In other cases, the immigrant serving agencies have been happy to support the work of new groups. And here I'm thinking about the South Asian Physicians Group in Peel Region, which when COVID was such a terrible phenomenon in Peel Region, began putting together TikTok videos, posting information on Facebook in 5 different languages, running a hotline where you could contact someone in 5 or 6 different languages. And the immigrant serving agencies have been anxious through these new relationships with these grassroots groups to support those initiatives. What we see then is 4 key factors. Diverse organizations. You need well-funded, stable organizations, small emerging organizations, and everyone in between. And the example of the schools, which are very well funded compared to everybody else, providing the tablets that allowed immigrant serving agencies to continue their programming online is a really good one. The advocacy examples are another one. You need a history of a collaboration. These relationships have to be developed and maintained. And in Ontario, the LIPS and their history of involvement in the Syrian refugee resettlement have provided a base, an infrastructure from which organizations could go on to respond. It is clear too, you need involvement from multiple scales. While it is true that I have emphasized in this talk local emerging grassroots initiatives, there is no denying that the federal government was supportive of, for example, the transition to online services. The last thing is you need cooperative funders. Doesn't matter whether it's charitable donations or government funding. What the immigrant serving agencies have done is they've conducted experiments, and those experiments will transform the landscape for immigrant integration. Some experiments fail. Academics are in the business of failing experiments all the time. Funders have to be willing to take the risk, let some things fail to find what will work. And I want to end with a quote from a report that John Shields and Lujan did in 2019. The key to building immigrant resilience is the same as building resilience in all of us, providing a deep sense of connection to other people and to the community. And a social resilience approach emphasizes those connections. Thank you.
Thank you, Valerie and Marcia, for that intriguing presentation.